Our thoughts are with those who have lost loved ones, who are fighting this cruel virus, and we know their hearts are heavy during this holiday season. Today, an update to our county alert map reinforces what we already know. COVID-19 is spreading rapidly through our state. As of today, 65 counties are designated as red, which means critical community spread. And 27 counties are labeled orange, which means substantial community spread. This is alarming. 92 of our 100 counties are designated as red or orange. In the last week, we saw a daily case record of 8,444, with the percent of tests positive coming back at more than 10%. This virus continues to spread quickly. Don't get numb to these numbers. They have plateaued a bit over the last few weeks, but they are too high. We have strong safety protocols in place right now, and we have to keep following them. I want to thank local governments and law enforcement who are helping to enforce them. Our communities are safer for it, and your efforts will save lives. I also want to recognize those communities who have seen law enforcement officers shot and killed in the line of duty in these past several weeks. It is senseless and appalling. Violence can never be tolerated, including against law enforcement. And our hearts are with you and those families. Calls to those families are some of the hardest calls that I make, and my prayers are with them and those entire communities. So last week marked the first distribution of the Pfizer vaccine to 53 of our hospitals. This week we'll continue distributing the Pfizer vaccine and begin distributing the Moderna vaccine as well, which is slated to go to 59 hospitals and 97 local health department sites. The federal government tells us how many doses to expect each week, and then the state decides where to send them. We expect about 60,000 doses of Pfizer vaccine this week and 176,000 of the Moderna vaccine. I've witnessed firsthand some of our frontline healthcare workers receiving the first doses of the vaccine. And Dr. Cohen and I were told yesterday at Duke Health that the most common side effect of the vaccine they are seeing is joy. Joy that is a good kind of contagious. I was so glad to see this because our frontline healthcare workers have had a tough time dealing with this painful, lonely, slow death and destruction caused by this virus. Until this vaccine gets enough people immunized, we owe it to those healthcare workers to double down on our prevention efforts like wearing a mask. When you think about their heroic efforts, spending all day on their feet in full protective gear, rushing from one ill COVID patient to the other, it doesn't feel so hard to simply wear a mask at the grocery store or when we are with people we don't live with. Come on, guys. We can do this. Finally, I want to warn about scams that we're seeing related to the vaccine. Don't fall for crooks calling or emailing you and offering a place on a vaccine waiting list. There is no such thing. They're either trying to steal your money, your identity, or both. The state has an action plan to distribute the vaccine effectively, and it does not involve calling you and asking for your personal information or your money. Now I'd like to recognize Dr. Mandy Cohen, our Secretary of Health and Human Services, for an update on where we are in North Carolina. Dr. Cohen.
Good afternoon. Thank you, Governor. We are at a moment in this pandemic of incredible highs and unfortunate painful lows. As the governor mentioned, he and I had the privilege of watching as our frontline healthcare workers who have been caring for COVID patients receive some of the first vaccines in the state. And you could see the relief on their faces when they rolled up their sleeves. It was gratifying to see these heroes who are courageously showing up every day to care for others get cared for themselves. We witnessed the promise of better days ahead. Unfortunately, those days are not yet here. And the lows of this past week have been painful. The number of North Carolinians who have died from this pandemic surpassed 6,000. Record numbers of people in our state are becoming sick enough to need to be in the hospital, and record numbers are in our intensive care units. And as you'll see from the data from our COVID-19 county alert system, all but 8 counties are red or orange. Let's walk through that report right now. As a reminder, the COVID-19 county alert system uses a combination of 3 metrics to categorize counties: case rates per 100,000 people over 14 days, percent of tests that are positive, and a composite hospital impact score. Using these metrics, we categorize counties into 3 colored tiers to describe the level of viral spread and healthcare impact. Red represents critical, orange, substantial, yellow, significant. This slide shows an updated county alert map. We now have 65 counties in the red at critical levels of viral spread. In our last report just 2 weeks ago, 48 counties were in the red. In addition, there are another 27 counties that are now orange with substantial levels of viral spread. That means over 90% of counties in North Carolina are red and orange, with the remaining 8 in yellow still having significant viral spread. If you are in a red or orange county, you should limit going out to essential activities and avoid people that you don't live with. On this slide, you can see how quickly things can escalate. That first map at the top is from just 1 month ago. There was a lot more yellow then. And remember, yellow still means significant viral spread. As you can see from the map on the bottom, our state is now mostly red. As I said at the outset, it's a time of mixed emotions. I remain very worried, and at the same time, I'm full of hope. Hope because we have vaccines that are 95% effective in preventing COVID-19. They were built on years of work to develop vaccines for similar viruses. More than 70,000 people volunteered to be in clinical trials that ultimately showed these vaccines are safe and work. And as of early this morning, more than 24,000 healthcare workers caring for COVID-19 patients have received the first dose of the vaccine. That data is now available on our COVID-19 dashboard. You can see how many people have been vaccinated statewide and by county of residence, as well as demographic information such as age, gender, race, and ethnicity. Supplies of vaccine are very limited for now. It will take many, many months to vaccinate everyone who wants it. Until then, I don't want to lose any more North Carolinians to this pandemic. Together, we can keep people from getting sick, save lives, and make sure our hospitals can care for people, whether it's for a heart attack or a car accident or for COVID-19. Keep wearing a mask, waiting apart, and washing your hands frequently. As you think about the upcoming Christmas and New Year's holidays, please avoid traveling and gathering. If you absolutely must, get tested ahead of time, wear a mask all the time, keep it small, and keep it outdoors. I'm grateful to the faith leaders here with us today who are doing all they can to protect their communities and finding new ways to join together in prayer and fellowship. Today, my reason is hope. Whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen. As you can see from the county alert map, we are concerned. North Carolina needs to drive down our numbers. To do that, we need to change our holiday plans if we haven't already. The best and safest option is to connect virtually or by phone. But if you gather in person, keep it small and outside if you can. Get a COVID-19 test before you go. Spread out the tables and the chairs. Follow the modified stay-at-home order and be home by 10 p.m. And as always, always wear a mask. It's easy to let our guards down when we're with our family. But no matter how much you trust and love someone, if they don't already live with you, keep wearing a mask. December is a busy time for our churches and other houses of worship, and many of them have found innovative ways to celebrate Christmas and other holidays safely through worshiping remotely this year. Today I want to recognize 2 faith leaders who are with us. Pastor Joseph Castile of First United Methodist Church in Rhodope Rapids, and Reverend James White of Christ Our King Community Church in Raleigh. They're here to share some of the steps that their congregations are taking to worship safely over the holidays. I'll recognize Pastor Castile first and then Reverend White. Pastor Castile.
I am Joe Castile, pastor of First United Methodist Church in Roanoke Rapids, and I want to express my gratitude to Governor Cooper and Dr. Cohen, along with a long list of people who have been working diligently in our local and state departments of health and human services. Through these months of pandemic, they have been a tremendous resource to faith leaders across our state. They have given us excellent guidance as we have endeavored to navigate the turbulent and uncertain waters. These waters have brought great disappointment to many of those we serve. While some have been very anxious to go back to the way things were, many others are finding comfort in the measures that we have taken to offer different and new opportunities. Since March, my congregation has only offered virtual worship. On Thursday night, Christmas Eve, we will be worshiping virtually for the first time in our church's history. I want you to think about it. The opportunity for you and your family to remain in your home safely. An opportunity not to put anyone else at risk. And the freedom for you to choose the time that you view that meaningful worship experience. Our service is going to go out at 5 o'clock, but you can watch it later than that. And there's another perk. You can fast forward through the pastor's sermon. So how cool is that? It's a win-win for all of us. This holiday season is going to be a difficult time, and is for many. My phone is ringing more frequently with persons who are struggling. These struggles are real. They need someone to hear them, to offer them hope, to assist them in finding a way forward through resilient supports. The Department of Health and Human Services has established 2 mental health hotlines that are available 24/7 in all 100 counties of our state. The first one is Hope for NC Helpline, and the number for that is 855-587-3463. Let me give that to you again, 855-587-3463. It's a place in which you can turn in your time of crisis. The second one is Hope for Healers. The number is 919-226-2002. Once more, 919-226-2002. It is a place for frontline workers and their families, healthcare professionals, first responders, and other staff who work in healthcare settings and they can assist them and help them in needs unique to their experiences. As a faith leader, I encourage you to take advantage of these resources within your local community. I also encourage faith leaders and my colleagues to be aware of the help that is available as we work together, staying behind the mask, washing our hands, social distancing, and staying home whenever possible. It is a way to provide a safer today and a bright tomorrow. Thank you, Governor. We can do this, and we are.
It was Maya Angelou who said, "You may not control all the events that happen to you, but you can decide not to be reduced by them." This quote is beautiful, and yet it's been a burden. It's been a burden for us not to be reduced by the challenges of these last 10 months. As a church, we've been meeting virtually for 10 months. And we plan to continue that journey knowing that God is not limited to or defined by physical space. No one would have imagined that the celebration of this year's Christmas season would be marked by limitations. None of us can imagine that more than 6,200 people would die at the hands of COVID-19, that there will be over 480,000 total cases here in North Carolina. The personal economic loss has been devastating. And some of us cannot even complete the famous words of Charles Dickens that these are the best of times and the worst of times. No, these have been the most difficult times that many of us have ever experienced collectively. Pastors and rabbis and other faith leaders are often expected to have words of hope. Maybe we're all appropriately lost for words. Because what is most needed are actions and perspectives that will lead to life now and in the future. Perhaps we all need to figure out how to create celebrations in the midst of limitation. This is not as impossible as it may sound because we have neighbors whose lives were devastated by systemic inequities long before COVID-19, only to find that in this time the gap to life as the Creator intended is now even wider. And many of us, we still feel, though, this unknown experience that we've never felt before, limitations. Limitations that have taken away the expected freedom of Christmas. Maybe we all need to remember that sometimes our intentionally forgotten history of indigenous people who experienced forced limitations, slaves who didn't have their limitations changed during this season, and even Jim Crow laws that have created cultural and societal limitations that we still experience today. And yet when we look back, we see that even with those tragic limitations, people were still able to have triumphant celebrations. Well, now, we have limitations that can lead to life later. Maybe the freedom to do what we want to do is not freedom at all. We can discover together the freedom to do what we need to do. Celebration in the midst of limitations, ironically, is the paradoxical story of this season. God puts on flesh, makes an appearance in the limited womb of an unwed virgin, an olive-skinned Middle Eastern child born in a feeding trough, on the run from the oppressive Roman government. Talk about limitations. However, 700 years earlier, Isaiah would remind us, for to us a child is born, to us a son is given, and the government will be on his shoulders, and he will be called Wonderful Counselor, Mighty God, Everlasting Father, and Prince of Peace. No, we cannot control what has happened to us, but we don't have to be reduced by what has happened. And may we together lead others to have a Christmas celebration in the midst of our needed limitations. And I'm thankful for Governor Cooper and his team leading us well.
Thank you so much, Pastor Castillo and Reverend White. We appreciate your efforts to keep people safe. And I hope that many congregations will follow your lead to keep their families safe this year. I know that I have been worshiping virtually, but I do miss my time in the pew. And if we keep working hard, we can get back. For this Christmas in particular, Christmas always has been a time of hope for me, a time to reflect on the year that has passed and all that we have to be grateful for. This year will be no different, despite or maybe even because of the challenges that we're facing. This has been a year like no other, and while it has been difficult and painful, North Carolinians have responded with compassion and resilience and courage at every turn. And at the end of this unprecedented year, let's recommit to keeping ourselves and each other safe so that we can be here next year to celebrate how far we have come.